Thank you again. Disclosure. I'm board member of the organization. So just want to make sure that our organization is Sikh Health Network, and they are trying to enable all the Gurudwaras, all the Gurudwaras to start a clinic in their Gurudwaras, and they have kind of they have, I think, 3 clinics which are through their organizations is running right now, and maybe we can get the guidance from them, and we can start our clinic here at this Gurudwara. So I think their presentation is going to be beneficial for us to hopefully start it for 25. So I'm going to ask. These are 2 young boys. You can see how young they are, and they are here with their mother. So these are Arman, Yoko, Sahib,
Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. My name is Arman Singh Johal. I'm a undergraduate student at UC San Diego, and this is my brother.
Hello everyone, my name is Sahib Singh Johal, and I'm a senior in high school, and I'm the co-founder of Sikh Health Network.
We've come all the way from California to attend NASPDA and listen to all the amazing folks in NASPDA and really be inspired by everything that's being done. And a big thank you to Swadlin for the invitation and everybody that supported us on our way here. We're here to talk about the Sikh Health Network. At its core, what we're trying to do is just like, how every Gurudwara, anywhere you go in the world, here in Charlotte, in California, in India, anywhere, you can rely on the fact that we'll offer Sangat to anybody, everybody, from any background that comes in. And the idea is, why can't we offer a wellness clinic at every Gurudwara? Like we do food level, why can't we do healthcare? And do these sorts of screenings for basic vitals, do these sorts of screenings for basic blood pressure, blood sugar, to make sure our Sangat is healthy. So we have 3 main motivations for the Sikh Health Network. One is to empower the Sangat with awareness of their own health, a preventative approach versus a treatment approach. Second is to assist any healthcare professionals to do seva in the local community. A big thing, a lot of you are doctors or dentists or psychiatrists, psychologists. We're trying to provide an opportunity for these working professionals, Sikh professionals, to give back to their community and do seva and help the local Sangat. And then third, we want to engage the youth community as well. Middle schoolers, high schoolers, college students, giving them an opportunity to volunteer, help the Sangat, and learn from the doctors and the psychiatrists and those working professionals, and get some sort of mentorship opportunity there. And here's what we try to enable at Gurudwara clinics. We enable the opportunity to do in-person or virtual consultation at the Gurudwaras. We enable wellness presentations, so sometimes we invite physicians to come up and give a presentation on healthy lifestyles, and give a dermatology presentation, mental health presentation. And then third, we also allow an opportunity for young Sikh students to give back to the community through these volunteer clinics.
And as you see here, we've collected data from 3 locations for 12 months, and as you can see here, for people over 65, the systolic blood pressure is in the danger zone. This needs to change, and that's why we're here. We're trying to reduce these vitals like blood pressure, blood sugar, and have a healthy Sangat overall.
So these are our intentions. We are flying back to California tomorrow, so we can't go and start and maintain these Gurudwara clinics. So what we're trying to do is inspire the local Sangat and find the key leaders in the community to kind of help them start their clinic at their local Gurudwara. Hopefully at this Gurudwara and others. We're backstage and not front stage. We have all the resources and all these sorts of things, and we want to empower the local community to do so. And again, we're sevadars at core. We don't want to take anything from Gurudwara. We want to give back We're not looking to put our name on anything. We really, as a mission, want to enable the local community to give all the resources we can, both legal, technology, logistic, all of that information and resources to the local community so that you can start developing this at your Gurudwara. And then third, we want to focus on wellness and not illness. The goal is not to replace primary care or traditional medicine. It's to allow a place for screening. It's to allow a place to talk to a trusted physician who speaks Punjabi, who's from the local community, for any sort of use case. If relatives, uncle, aunties are coming from India, they don't have a support system, coming and talking to a certified psychiatrist for mental health issues, or talking to a certified doctor about any issues they might face, or where to go, what procedures to get. If you want a second opinion, coming and getting a trusted second opinion from a member of the Sangha, having that resource at the Gurudwara, we feel is really beneficial to the Sangha and what we want to promote. And here's what we offer at the Sikh Health Network. One is technology. I'm a math and computer science major at UC San Diego, so I developed and created a HIPAA-compliant electronic medical record system that's used across the clinics of the Sikh Health Network across different Gurudwaras. And I also created a telehealth platform that enables physicians from all over North Carolina, all over the US, to be able to consult in minutes with any member of the Sangha that comes to the Gurudwara clinics. We also offer liability protection for physicians. Any registered physician that are participating in these Gurudwara clinics will get blanket liability coverage so they can be insured and not have to worry about any sort of malpractice. And then fourth, convenience. Again, we're trying to offer as many resources as possible to the Sangha to make it as easy as possible for our Sangha to help each other. And this is just a screenshot of the telehealth platform that I developed. We have a growing number of physicians on the platform. If any of you are physicians, psychiatrists, psychologists, dentists, anybody who wants to get back to the Sangha, we'll have a slide where you can kind of reach out and volunteer and join this Sikh Health Network to give back to this community.
And this is the process of how we do it. First is to sign up, then is to set up, then it's onboarding patients or doctors, then it's the training and support for these volunteers who are gonna input patient data, input vitals for the EMR system. And this is the typical patient workflow at a Sikh Health Network basic clinic. First is the registration. So there's going to be 2 volunteers. They register patients in the EMR system. Then the patient goes to the vitals table where they get done blood sugar, blood pressure, oxygen, temperature, pulse, and that is logged in to the EMR system as well. Then it's the physician consultation, which is either in person or virtual. And this will be done in a private space because we want to respect patient privacy at all costs.
Our progress so far, I'll make this quick. Right now we have 3 clinics up and operating with over 2,000 patient encounters. One is in El Sobrante, Fremont, and Sacramento. This is all in California. And these are just the number of Gurudwaras we have across the US, and the number of Gurudwaras we have across the world. And imagine, just like we have one, but imagine if every single Gurudwara had the basic ability to, for anybody from any background, to come in and get trusted advice, to get basic screening, get their vitals done, and have that sort of trusted system in place. And that's the thing we have at Sikh Health Network.
And this is our team. As you see here, there's our team members and our board members. Special thanks to our board members for offering their time to help us with this project. And this is not including the hundreds of volunteers who offer their time as well for these clinics.
We have volunteers from all over. We have Nimar Jahal, who's here, her younger sister Noor. She's a middle schooler and she's helping in these clinics. She's learning, we're all learning Punjabi through running these clinics. So it's a great opportunity for the youth as well to get involved and help the Sangha, especially those interested in going into healthcare, going into medicine. Not only will we be helping our Sangha through wellness, we'll be educating and empowering our youth to really be involved. And our ask of you, the reason why we're going to presenting this is we want to take this to the next level. We want to help as many people in our Sangha as possible. We started in California. We're now talking to a few Gurudwaras across California, New York and Florida, and North Carolina. We would love for this Gurudwara potentially to consider having a clinic here and helping your local Sangha. But in order to do so, we need physicians, we need volunteers, and we need the Gurudwara Sevadar support. So in order to help, whether you're a physician, whether you're a volunteer, whether you're part of the Gurudwara admin, whether you're not even from here, you're coming in visiting, if you want to help in any way, you want to volunteer virtually as a physician, you want to put some time in any sort of way to support these Gurudwara clinics here and other places, please go ahead and pull out your smartphone and you can either take a picture of this or scan this, and that'll lead you to a couple of questions just to fill out, that will know, if you want to volunteer or help kickstart this at this Gurudwara. We'll give you the necessary steps to do so. And again, just closing remarks, our whole mission here is to empower the Sangha. We've come here from California, first time in us for Charlotte, and we've been met with so much kindness and so much love, and it's been great to have a community here, and we really want to give that back to that community. So we want to have Gurudwaras, whether it's someone looking for a second opinion, whether it's a child who's not comfortable speaking to their parents, come to Gurudwara and talk about some sort of mental issues or some sort of pain or something they face. We want to have a safe space and a place for that. And that's kind of what our mission is. So please, if you're interested in volunteering, scan this, and then thank you very much, everybody, for listening, and thank you to Small Uncle for the invitation. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.